Amal sir, go ahead, sir.
हाँ? नहीं, बहुत मुश्किल।
Kamal sir, you can start. I will introduce the moderators just when they are about to start.
Amal sir, hope you are audible, sir. Hello.
Dr. Kamal, please start.
Yes, we can start, I think.
Dr. Sushil, I think he's here and has a problem with the sound. You can start that.
Okay, okay. Am I audible, sir?
Yes.
Yes, sir, you are audible,
Yes.
sir.
Dear friends, good afternoon and welcome to yet another session of the CBME Series 3 workshop. And as you all know, this workshop is being conducted by the National Association of Pharmacology and Therapeutics. And for the last 2 weeks, we have had very, very enriching sessions, very, very useful sessions on interactive lecture taking, the concept of flipped classroom, how to prepare long answer questions and short answer questions and MCQs. And the feedback from the participants has been absolutely encouraging, and we are overwhelmed by all the love and the affection that has come to our way. So in the continuing of the session, we'll be covering very, very two important topics this time. And the topics will be on logbooks in pharmacology and the art of Viva Voce. Both the topics are very, very important, and I hope and I'm sure that they will be of great benefit to everyone of all. So with that, I just request Dr. Kamal sir to please carry on with the proceedings.
Am I audible, sir?
Yes, sir, please continue.
Yeah. So, welcome to National Association of Pharmacology and Therapeutics. This is the third series of CBME in pharmacology. And before we can start this CBME session, I would like to announce that we are getting a very good response for our National Pharmacology Conference going to be organized at Bangalore on 28th and 29th October 2022. And with these words, I just would like to add that if any postgraduate student or any faculty member regarding the paper presentation or poster presentation having any kind of the inquiry, they can directly either can contact me on my WhatsApp or can call me, or they can contact to the organizing secretary, Dr. Padabja Uday Kumar. We are available to assist you for all kind of the help we can provide. Thank you all. And Jai Hind, and with these words, I would like to request our organizing secretary to release the NPT video, promotional video. Thank you very much.
Yes, sir, we can have the video released. Thank you, sir. Thank you very much for that excellent video showcasing our specialty. With that, we'll start the proceedings, and let me start by welcoming two of our very, very eminent members who will be moderating today's session. For the first session is going to be moderated by Dr. Padmanabh Rataboli, who will be moderating the session, which will be taken by Dr. Dinesh Badyal. Dr. Padmanabh Rataboli has got a wide range of achievements and awards, as you can see. He is currently professor and head of the Department of Pharmacology at Goa Medical College. And not only pharmacology, he is interested in diploma, he is interested in naturopathy, and he has done his diploma in herbal medicine also. He has got more than 100 research publications, has got the Best President IMA Award as part of the President of Goa Medical Council. So I welcome you, sir. And now we'll go to the next moderator. The next moderator is going to be Dr. Rajan P. Nerurkar. Dr. Rajan Nerurkar is currently the professor and head of the Department of Pharmacology at Kopiwala National Medical College and Nair Hospital, Mumbai. Dr. Nair has got a wide teaching experience of more than 35 years in variety of areas, including rational pharmacotherapy, research methodology, biostatistics, etc. He's also got tremendous experience as part of the IEC secretary and also the chairman of IAEC in his institute. And he has got many publications and scientific papers to his credit. So I welcome you, sir, for today's session. So continuing, may I now request Dr. Padmanabh Rataboli to please take over the proceedings and introduce the first speaker.
Thank you, sir. Am I audible?
Yes, sir, you are loud and clear.
Good afternoon, colleagues. Logbook forms an integral part of the formation assessment program, and it should be submitted before the examination and available for university examiners to review. These specified activities that are part of the curriculum need to be captured in the logbook. To tell us more about the logbook, we have Dr. Dinesh Kumar Badyal, Professor Medical Education and Pharmacology at Christian Medical College, Ludhiana. He has contributed significantly to the new UG as well as PG curriculum in India and is the national convener NMC Advanced Course in Medical Education. He is the author of more than 130 papers, 2 books, and several chapters in other books. He is the author of
Sir, you got yourself muted, sir, please. You have to unmute yourself.
Sir, hello.
Dr. Rataboli. Dr. Rataboli.
the stage is all yours.
Okay, sir.
Good afternoon, and thank you, Dr. Rataboli, and all the dignitaries. One of the issues which we discuss a lot these days is logbooks, because we are getting various forms of the logbooks made by institutions or commercially available. And so there's still a struggle how much volume it should have, whether it should be something around 40 pages or 240 pages. So let's go through that, mainly highlighting the pharmacology component. So as per definition given in logbook, you will find various definitions. This is one of the definition given by NMC in the logbook guidelines, that it is a verified record of progression of the learner documenting the acquisition of the requisite knowledge, skills, attitude, and competencies. So you're logging in those observations about the student. Since these days we talk about competency. So when we talk about these competencies, which are habitual and judicious use of communication, knowledge, technical skills, cleanly reasoning, emotions, values, and reflections in daily practice for the benefit of the individual and communities, it means these competencies need to be observed daily. So logbook will have login of some of these activities, but not all the activities. Now, if you look at these guidelines which are available, these were published at that time by the MCI, available on NMC website. Remember, logbook is not another practical record book. We have seen logbooks which are very voluminous, 240 pages, 300. They are becoming like books only now. So that issue need to be tackled. Basic structure of a logbook, as per the guidelines given, is that you need to have a competency, name of activity under which you will observe that competency, when you are doing it, attempt at activity. We will see in detail all these things, and how we are marking or rating, decision of the faculty who are observing, and any remedial actions or feedback which is given. This is the basic structure. Over and above, you can add many things. So when you plan to design a logbook, you should keep in mind that you will be choosing competencies. Not all competencies need to be added in the logbook. Certified competencies, competency related to P level, which you might have seen this Miller's pyramid, which tells you about levels of competencies. So mainly perform shows how competencies, and psychomotor communication domains will part of that. For example, other components which you can add is self-directed learning, reflections, narratives, creative writing, which other places will not happen, but can happen very beautifully in the logbook. We will see that example also. Presentations like seminars, symposia, that can make part of that. So choosing competencies, looking at the level of achievement and the timeline, when it has to be done and who will observe that. Remedial actions, number of times you will find one activity has to be observed for number of times. It is already written in certifiable competencies. 1 time, 2 time, it goes up to 5 times. So it is possible that first and second or 3, some part is still remaining. So you will provide some feedback to students, some remedial help is provided, and then it is assessed again on 4th and 5th time. And how we document it into that. So documentation part, you can see one is this format, which is given in the logbook guidelines. Another is when you document, you need to explain these components at 1 page in the logbook, so that everyone, all the stakeholders, that is students, faculty, and somebody else who is evaluating in the principal office, they are well aware of these marks which you are putting up. First attempt, repeat, remedial activity, below expectations, meet expectations. I think most of you will see this is already given in the guidelines, and we see many of the logbooks are using the same component. Now, before I go into details of the logbook, I'm just showing you the pattern, the title page right now. We are going detail into pharmacology. Some general guidelines are same. So before that, I would like to show you the filled logbook by the student, and the student, let's have few viewpoints about that. So first I have a phase 3 part 1 student, Avni, who has already gone through this year, phase 2, and she has her filled logbook used in the year 2 pharmacology component. So you see here, this is a marked components. We are looking at certified competency in the pharmacology. The teachers looking at deciding whether it just meets or exceed the expectations. And then when it is completed, date and sign. So it goes for a number of times. You also can see 3 times, 5 times, it goes like that. So Avni, what else you have added here?
Good evening, everybody. There is space for these seminar quizzes.
This is not visible.
We will show you that part also, sir. So there's a space for seminar projects, quizzes.
So like the second year in farm, they were not conducted, but if any quizzes and all were conducted, these could be added here. Some of them were conducted in micro.
You have SDL topics there.
And so this SDL.
SDL topics, blocks taken, block 1 to which teacher has taken. Okay. Did you find any utility of a logbook like this?
Yes, sir, and there's this last page also which requires us to like write the reflections. So this page I believe is very important for us, and especially like because we can write what we liked about whatever was conducted, and at the same time there is space for the teacher to actually tell us that if there were anything we can improve on before our, especially before our profs. And the certifiable competencies, I believe that getting a below expectation or a meets expectation is helpful, because it helps you to understand if you can improve in the next chance, because you have more than one for every competency.
So when there was like B, So
Yes,
there was
sir.
some remedial action provided. Somebody
Yes, sir.
helped you to
So I
achieve
was
that.
told to told what problems I was and what I could improve, and then the next.
Okay, thank you. Thank you, Avni. So we have a Pulkit who is presently year 2 student and he's going through this logbook. So Pulkit, what you find is the utility of a logbook?
Sir, according to me, there are various certifiable competencies which are very important for me. So I've from my home also I've read about the topics so that I don't want below expectations. I always want to exceed expectations. It becomes important for me to pass these certifiable competencies, and these topics are important.
So it means the ratings are now in your mind that somebody will observe your mark.
Yes.
What else? You also felt similar things. You have SDL topics coming up, and you have reflections writing still to come because that is at the end of the session. So when they complete all the SDLs, they will write reflections about that particular, for example, pharmacology here. Do you find apart from like when you are aware of that you are being observed or assessed and you try to read that?
Yes.
So that is one advantage. Any other utility of this logbook?
So these in our SDL sessions, these topics, if I was not going to be evaluated or not going to be signed, I would have taken it less important. I would have skipped that thing. But now I know that sedative hypnotics is a very important topic. I have read it and I know it through by my heart. Even drug of abuse, why drug of abuse is very important, as well as pediatric and GLD.
Thank you. Thank you so much. Thank you so much. So let's continue with that. So see, this is the standard page you will have, which comes in the after the title page, and then general instructions. These are given in the logbook guidelines also, and you can customize that accordingly. So remember that some legal implications are there about the logbook because there's a log of the records. Number of universities later on asked this, that we need a logbook. Reflection writing is very important part of logbooks. It should be there, but not with each activity. For example, one SDL topic is over in the pharmacology or one another topic is called, you take reflections. That will be too many reflections. Then it becomes such sort of copy paste. So when you have finished maybe 10 SDLs, you have also, and this is doable or feasible, and teachers can also read through that. Grading, if you want, you can do that. Similarly, there is a space for topic modules, AIT topic integrated. Now, this is important because in integration, when we see all topics are involved. So pharmacology will be part of almost all these parts. So we already printed this, and accordingly, who is in charge and all that, they take care of that. We are coming to hardcode pharmacology part now. And you can see here, these are certifiable competencies. Apart from that, we are giving a flexibility of one more page so that if any department thinks few more competencies are important, you can write. You need not write all, but certified competencies are must. Few more you think are important, you can add on, but do not try to fill the entire logbook with all the competencies. What is important is how you are marking it. You have just seen the students and how the faculty has marked on their logbook pages, which level they stand. If it was less on a particular component, B, students are also aware of, and teacher also has given that marking, and the feedback is given. So accordingly, feedback, see, remember that it is not only fault finding, but remembering to help them. That is the function of the logbook. If you see the guidelines in internal assessment as well as logbook. Number required to certify, sometimes people confuse and they do not have these 5 rows. And they just do it on the same day. It should be done on different days. So that on one day when you find there are some steps to be improved, that feedback is given. Student goes and repeats that activity again, and then again there's observation chance, again observation chance, and like that till they achieve competency or they exceed the expectations. So in that way, you will try that every student achieves at least meet the expectations level. Some of them will exceed the expectations. So that was the actual purpose of designing the logbook in such a way. Similarly, other components, number required to certify, you can see. If you have other competencies which are not certifiable, but just competencies, you can devote one row to each of them. No, a lot of departments conduct other components, seminar, projects, quizzes, academic activities. Not the extracurricular activities, but academic activities of that particular department. That you can enter into this. SDL topics, which the blocks if you're using accordingly. So you add your SDL topics, and after each SDL. So this also makes aware of students about the importance of SDL, because in many places we see they skip selectively some of these components. Reflections are very, very important at the end of all the SDLs. So that is the usual practice. And remember that Logbook has now weightage in internal assessment. So as per NMC rules, it can be up to 20%. So here we have given in our university to 10% in theory, 10% in in the practical component. In both it comes into that. Other components are also there, but Logbook is important. So it means you are taking many components in internal assessment. Logbook need not record everything. You have other components, let it be there. Sometimes people try to copy paste all pages of Gazette of Pharmacology into the Logbook. That is also not needed. It's mainly log of activities the students are doing. Other guidelines, our distribution, everything is given in the Gazette. So that's a separate component. So after looking at that, another component important is Logbook in the MD courses. Now, if you see the revised guidelines in the competency-based PG curriculum in pharmacology, 10 days before, it is already written and they have given this sort of format also. So PG students shall be trained to reflect and record their reflections. Reflection writing is very important here also of the critical incidents, which can belong to various components which you are observing. Then good teaching practices must be assessed in all academic activities. So the teaching faculty, so you can actually refer to the MCA booklet, what they are sales. For example, one component I am taking under Journal Club, they have written, the presenter shall be assessed by faculty and grade recorded in the logbooks. And record and logbook shall be checked and assessed periodically by the faculty members, imparting the training. Remember that person who has imparted the training. And this is essential prerequisite for the appearing in the university examination. I know many of your institutions are using PG logbooks already. So based on some of the formats given, you can update that also. And if I show you this PG logbook, the size, earlier size, you will see that I have a logbook of this. This is a second year logbook, all the subjects together, around 40 pages. So one logbook, 1 year, that's the format which you're following, and most of the other colleges here. I have other logbooks also. I'm not showing the title and all. You can see the volume here, around 200, 300 pages. That becomes 2 voluminous. And this is the PG logbook. You might have seen that it will have various components, postgraduate training, seminars, other components, journal clubs. In the event, you can have marks also, another component written to that. So this can be a complete book. So the PGs also. So in that way, if you want to balance, you can have some balance in the logbooks, although brainstorming is needed first at department level and that at the institution level, so that your MD logbooks in all MD/MS courses look similar. They have similar guidelines being followed in one institution. If you have university level logbooks made, then you can use that. So the main purpose of discussion with you and sharing the views of the students who were randomly picked up was that to show that how that there are 2 important stakeholders, faculty and the students. Sometimes faculty wants this should also be added, that should be also added. Please involve students also when you design a logbooks and ask them, they have already used for 3 years, what they want, what are the things which are just becoming copy paste. Okay, which are the things which are really happening, as some of the students today told that when they actually do it, it is written there, they know they are being observed. So they go back, they learn about that, they read about that. That really may help them to achieve that competency. That is the purpose of giving logbooks, making sure the feedback is provided to the lacking components and they can update that. I will stop here and ask for some of the questions which are there. We will go through the chat as well as some of you who want to ask, you can unmute. Dr. Rataboli, maybe you can ask.
Yes, sir. Thank you, Dr. Dinesh. It was a splendid presentation. I just want to ask you one question. In the competencies, certifiable competencies, there are 3 competencies marked for the drug promotional literature. Do you think there are too many? We thought 2 are enough.
I'm not going into that domain because that has been finalized already. So whatever regulations has, we have following that right now. So our purpose was basically to see that certifiable is a must right now because they are a university requirement. All certified competencies must be observed and signed by the teachers. That is the one of the 3 requirements for to appear in the university examinations.
Yes, I agree with you.
Yeah. So that logging is a legal requirement. We can say that it must be done. Otherwise, student can say this college has not done any login, so there is no record. This is happening in other things also. So then it becomes a issue.
But in addition to logbook, we do have practical journal.
Yes. We should continue to have that, where we have detailed practical exercises, and that will be a part. Logbook is important activities.
Yes. Any other questions from any participants?
So there's some comment added by Dr. Chitra. We should add publications, poster presentations, conference. Yes, MD logbook has that. You should add that. So that the components should be there. Yes.
In fact, for MD, if they have some pharmacovigilance activities, even that could be shared in the logbook.
That should be actually part of that.
Yeah, that's what we do here.
In our logbook, let me show if I can reach that page quickly. So how many ADRs they submit per month, they have to do, and ADR people who are in charge of that center, AMC center, they will certify it.
Okay.
So that is a regular activity. So anybody has a question, you can raise your hand also. So then your name will pop out at the top and we can unmute you. We have a 1 or 2 minutes.
Participants can unmute themselves and they can ask the question directly or by raising the hands.
Yeah, so there are some questions, but the names are not there, so I'm not able to take that. Dr. Renu Gulwani has asked reflection writing in MD on which topic? So for example, when you complete 1 year of journal clubs, you can ask them to write their experience, reflect on the journal club experience of the last 1 year. Similarly, it can be on the human experiments if you're doing other components. So not single activity, but sum total of some activities. Should there be, Dr. Jayalalita has asked, should there be one logbook for all phase 2 departments together or individual? We are using single, all the colleges in our state, single logbook for all the subjects for per year. Teaching, Dr. Nerurkar has added, teaching assignments done by student can be included. Yes.
What about visits to companies?
Yeah, that I was not taking because the name was not there. So, sir, that is also now part because it is a part of the MD pharmacology training.
Yes,
they should write that.
So should they enter their activity?
Yeah, and the supervisor who is there at academic level and at the company level, they should sign it.
Yes.
Should we give marks? Dr. Chitra said give marks to journals and logbook both. That depends upon the internal assessment pattern which you are using for the postgraduates. And undergraduates already 20% weightage is given, so we are converting that to marks. I'm not logbook combined, journal and logbook be combined. No, I think journal you're talking about practical record book. Keep it like that, where you have details of that. Logbook is a separate thing. So I think if there are more chat questions, I will reply on the chat and we go ahead.
I think we have over short time. Thank you, Dr. Dinesh Badyal, for a fantastic presentation. I think most of the queries were dealt with, and all of us will be now better equipped to have our logbook presentations. Thank you very much.
Thank you. Thank you, sir.
May I now request Dr. Rajan to please introduce the next speaker?
Yes, sir. Good afternoon, everyone. I'm introducing Dr. Gurudas Khilnanai, sir, who is a very senior person with total experience, teaching experience of 45 years. He is a double graduate in MD in not only in pharmacology, but also in general medicine. So he's got a lot of clinical experience. He has been Dean for 10 years, HOD for 21 years. He has been member of Governing Council of GMERS, Rajasthan Medical Council, and Executive Committee of Indian Pharmacological Society, and also a founder fellow of Indian Society of Cardiology. He's a master in medical education technology, as he has done a lot of NTTC course in PGI Chandigarh, and has also done advanced course in medical education technology. And he has a lot of publication. He has written 3 books on MCQs, family medicine, history of pharmacology. He has written chapters in textbook of medicine by API, and has over 70 research papers, including many on medical education and CBME curriculum. He is the most right person for today's session, and he will speak on art of Viva Voce, and he will enlighten us on how we can improve the quality of Viva, reduce subjectivity, bias, etc. Dr. Gurudas Khilnanai, please take over.
Thank you, sir. Should I share my screen? Hello?
Yes, sir. Please share your screen.
Is it visible, sir?
Make it full screen.
Yeah, sir, it is visible. But full screen is needed, sir. Presentation mode.
So it is okay?
No, sir, not yet done. Presentation mode, sir. The 68% is there.
Slideshow. Do slideshow, sir. Slideshow.
Yeah, slideshow.
Do slideshow.
Sir, here it is 68%, sir.
68%.
Yeah, sir. Next to that one icon is there, no, sir. Already cursor is pressed. Just double click on that.
Which one? Resume share.
Left side of 68.
Sir, otherwise here in top home, insert design animation is there. No, next to that slideshow is there. Click on that, sir.
Slideshow, I already done it. It is visible.
Sir, top panel you
Top,
see.
sir. Top home insert is there. No, sir. Top.
Go to slideshow.
Can't see anything now. So should I
Stop
redo
sharing.
it?
Sir, stop sharing.
Redo it then.
And when you redo, sir, on the first screen which will come on the left lower panel, optimize for video and share sound. Just click on that and then you share.
No, there is only one thing which I am showing you. Share screen.
Click on that, sir.
Okay.
The screen which comes, there are 2 options to tick on the left side.
Optimize for video clip.
Yes, yes, and share sound.
Okay, share sounds. Okay, done.
And now you open the file.
So it is okay.
Now go to that icon. Yes, it is coming up, sir.
Who can share? Host only or all participants? Fine.
So just press next button. Next slide.
Okay. It was earlier, it was better.
So we
Now
don't.
only gray color we can see, sir. Nothing else that.
Sir, you stop.
I think let me try this one.
Yes, now it had come. Full screen.
But it is my picture, not these slides. So let me see it now. I'll do it again. So it comes again this
Yes,
way.
sir. Now it has come full
Good.
screen.
Yes.
It has
That's
come.
it, sir.
We have got it, sir. Please continue. We have got it.
Actually, it's not moving now. Can somebody help from there?
Yes, let me see, sir.
Can somebody do from there?
No, sir. Their controls are with you only.
Okay. Now it is changing.
Now it is moving, sir.
All good,
Okay,
sir.
fine.
Yes.
So let me start because it will. This presentation has objectives that we should be able to choose the Viva as an assessment tool, identify factors which determine the success of this encounter, analyze the values and the limitations, and more importantly, structure the Viva questions and entire Viva session so that outcome is better. This will be in two parts. Part one will be purpose, value, and limitations of the Viva. And in this part, we already know Viva is not only science, but it is an art of using scientific principles to assess a student. Since it is direct contact, a conference between two, we usually talk and listen, but it's better to use variety of tools, specimens, different dosage forms, drug administration devices, modules, treatment sheets, drug comparison sheets. Even we can construct therapeutic problem solving exercises and discuss out so that we know what depth of the knowledge the student has acquired. Now, generally the purpose of Viva is to explore depth and breadth of the knowledge. So we always start from must know to nice to know, not the reverse. And usually we start from recall to application, synthesis, evaluation. Later on, we'll realize that reaching to application, synthesis, and evaluation require a lot of the homework. Viva can also probe more deeply into other parts. For example, logical thinking, decision making. For example, we can use an algorithm that intracardiac adrenaline will be indicated at what time if you encounter a patient with cardiac arrest. Clinical case scenarios can be used to
Sir,
Voice is not coming.
I guess his bandwidth is low, sir. Gurudas, sir?
Voice is not visible. Voice cannot be heard.
now. Similarly, Viva can also be used to individualized therapy.
I guess he lost his network, sir. Gurudas, sir, unmute, sir. Kindly unmute, sir. No, sir, your voice is not audible. Unmute yourself, sir. Sir, unmute, sir. Dinesh, sir.
Yeah,
Actually, yes, Gurudas, sir, has not unmuted.
I am trying to convey him. Yeah, he's trying to find out the button.
Yeah. Gurudas, sir, unmute.
हाँ sir, I am trying.
Yes, sir.
हाँ.
We can hear, sir.
Okay, fine. So
Yes, sir, proceed, sir.
but screen doesn't move then. I have to,
Session, yeah,
Yes.
session outlet is in. It is in
Fine,
session
fine.
outlay, sir.
okay. It takes time, but it is not moving.
Sir, it's moving.
But it's slow actually.
It's okay, sir.
Now it's coming up. Okay,
Yes.
fine.
Yeah, sir. it is
Actually, because
ma'am.
of the ringing of telephone, it creates problem. Now, Viva has a multiple purposes, and as I told you earlier, no is hang up. What to do now? Is
You have the
visible?
control of slides.
It's not moving. Let me redo it.
Kamal sir, you got his presentation?
I have given him.
Sir, I have got his presentation and I can play it from behind. You can continue, Dr. Gurudas Khilnanai.
Dr. Gurudas sir, आप continue करिए. He will show the slides. You keep on continuing.
Okay. No, but it should move now. That's some more important. It should move.
Kamal sir, share the screen, sir.
I can share the screen.
No, sir. Gurudas sir, Kamal sir will share the screen, it seems.
Yeah, madam, Dr. Gurudas, please disable his screen sharing so that Dr.
Okay,
Kamal
I can work on this mode, and should I continue?
Gurudas sir, Kamal sir will share the screen from behind.
It is F10.
Kamal sir, share the screen, sir.
Okay. This create problem. It is now changed. Somebody else is doing?
Yeah, sir. Kamal sir has shared the screen, sir.
Okay.
I guess it is, see, sir.
You please
go 2 slides back.
You please continue, sir, from here only. Doesn't matter.
Okay. Okay. A questionnaire was introduced to participants, and I received 105 responses. And actually, all the teaching faculty participated. Almost equal distribution was there. Next, please. And what you will see here is that people feel that adequate time for Viva Voce is approximately 8 to 12 minutes, not 5 minutes, not 15 minutes. And this response is shown by almost more than 50% of participants, 24.8 plus 20. Next, please. Now, broadly, the reasons for declining importance of Viva, I grouped them into 3 parts: examinee related, process related, and examiner related. Next, please. And these are the determinants or the factors. There are many. The yellow ones are what the participants have reported: knowledge, attitude, mood, personal priorities, lack of training, personality. And the process related factors, process of Viva, leniency, central tendency, these terms are well known to all of us: halo effect, error of contrast, time given for Viva, and the test environment. It may be intimidating, conducive, or threatening. Next, please. Examinee related factors are again many, and they include the background, educational background, the medium of learning. Next, please. Medium of learning. Then ability to reply, pace, back. Sir, back, please. Ability to acquire the pace, level of confidence. Some are diffident. Language, ability to pick up the cues, non-verbal cues, examiners give a lot, and level of anxiety and sometimes pain, illness. All these factors which are related to examinee will ultimately determine the outcome. Next, please, sir. Now, another question was the opinion about subjectivity and objectivity. Now, very interesting outcome has come up that people feel, yes, it cannot be subjective, 12.4%, but what is more important, despite being subjective, it is a good measure. It is a good measure to test the domain learning. Now, this is very encouraging to see. Next, please. Viva Voce should not be included in summative assessments. Now, people replied the way, strongly disagree, 33%, and disagree 41%. So total more than 74% say that it should be included in other way, it should be included in summative examination. Next. Next, please. Now this is, there are 5 variables on which the opinions were obtained, and inter-examiner or rater variability was high, as people feel. But what is more important, people don't feel reliability is a question. It may be reliable, it may not be reliable. Back, please. Maybe reliable, may not be reliable. That is important. And a time constraint is always there because it is time consuming. Dependency on the communication is very important. People are very high have been reported by others. Please. And indifference and, sir, please keep it that way. Indifference and the diffidence. Now, this is a new factor which is coming up. The students are not bothered about Viva. It's okay. Viva le lenge to kya ho jayega. So this is, we have to tackle this problem. Next, please. Advantages of Viva is formative assessment. Yes, there are many advantages. 81 feel it promotes communicative skills. That's very, very important part of the pharmacology practicals. And 77% feel that even deeper levels can be assessed by properly constructed Viva questions. 68% feel they provide immediate feedback to students. I think this is most important for formative assessments. Next, please. Should be a pass criteria for Viva and university examination. Now today, 48.6% say yes, it should be. Next, please. Therefore, if carefully constructed, Viva can assess the higher levels where candidate shows how and does. Means if proper material is tools are kept and questions are put, these can also be assessed. Even critical reasoning can be assessed. I will show you some example later on. Please, next. This is an example what actually happens in Viva. There is an elderly examiner and young examiner. Elderly begins, GIT is the first question, PPI is the answer from student. Young examiner says, what are two uncommon adverse effects of long-term use of omeprazole? Obviously, being uncommon, student doesn't reply. Now, senior person asks, what are the adverse effects of antacids? One answer is constipation. Why not diarrhea? Now, the way the young man asked from the student, next please. Next please, yes. So, Viva never began. You can see that the rest of are already there. You can see there was no greeting, student was not given any comfort, and young examiner became hawk. Next, please. So, one question which is, sir, back. One question which a student replied was life-saving uses of adrenaline. I think good answer. Anaphylaxis, cardiac arrest, hypertension, good problem, but he is not rewarded. He never said good or bad. And finally, another question is adrenaline used to raise blood pressure in shock. Now, this question a student must understand because it must be taught. Only then he can answer. So it requires change in the teaching learning methods. Next, please. Limitations of Viva and formative assessment. A student will succumb to partiality and favorism. It is a clarion call to we teachers. What are we thinking about the outcome of a Viva? Is it favorism, partiality, or something else? So this must be taken into consideration while making a Viva encounter. Please, next. So there is a declining emphasis. Universities in many countries don't include, even in CBME, role of Viva is only in practical marks. Some universities are 10 out of 100, others are 40 out of 100. So there's a wide range. And it is just part of the practicals, not separate pass marks. I feel Viva is a very useful tool and it can be appropriately used to find out the depth of learning. Next, please. Sir, next, please. Now, suggest two ways to increase validity. The responses were pre-validation of card, validation of questions. There were others also. I think these two I have picked up and made some changes also. Next, please. Now, part B. There was one more slide, how to increase the reliability. Again, there was 59 responses, and I will take up the structuring. I will be showing you because perhaps time is out. Now, ultimately, what is Viva? Viva is not I know, you do not know. Next, please. So Viva is, I know that you know. I want to assess how much you know. Therefore, I will construct the questions must know, core, very important, relevant to IMG. Next, please. So how student can make most out of the Viva? This is very, very important for a student. Great. Answer only when you have understood. Request to repeat if not understood. Accept in humility if you do not know. Request for another question. Don't use confabulation circumstance. Sir, ऐसा होता है, ऐसा होता है, ऐसा कुछ नहीं. Don't waste time. Just as in acute myocardial infarction, minutes means myocardium. I would say in Viva of 8 minutes, minutes means marks, and student must know it. Request for more questions if you think you are not adequately assessed. This is again important. Actually, in my experience, very few students dare to do this, but some of them did, and I had to give some more time to them. And finally, when it's next, please. Next, please. So, what students are actually expected, they should know before Viva. So we should have a small pre-Viva session. Now for teachers, they should plan a session well, increasing reliability by careful selection of examiners. That means actually the institute as well as university, and independent examiner pairs more examiners. Next, please. Increasing validity by structuring cards which correlates with the theory marks later on you would see, and use of pre-validated cards from department question bank. Viva question bank can also be made. Next, please. A checklist should be there for evaluation. Now, this is a self-assessment checklist after Viva encounter for teachers. Young teachers can use it. Was I courteous to candidate? Were the questions clear? Was interval between questions too short or too long? Was I interested in listening? Did I contradict the replies too often? Was adequate time given to candidate? Did I allow extraneous factors? Did I try to impose on candidate what I knew? Did I try to find out how much did he or she knew? And how candidate acquired sufficient competence as acquired for IMG? Now, if last question you can reflect within, I think a student would get that much marks. Next, please. So this is for self-evaluation. Now, how to make more effective? Structure Viva card, number 1, is not one-man show, group show. Second, teamwork. Second, you can structure systemic-wise, paper-wise, topic-wise, subject-wise, whatever way is comfortable. In pharmacology, I would always suggest system-wise. That makes sense. Preparation of equivalent cards. This is very, very important. Each having 8 to 10 questions, and of at least one question 1 minute. Each question to be carefully framed and should have unambiguous answer. Answer should not be 2 or 3 or 5. That becomes problem. Pre-validation, ascertaining time per student, number of examiners, syntax errors should be removed, and feasibility testing must be done by piloting. Next, please. Now, this is one example. I'll be going hurriedly little. See, this we start from simple to difficult. Adrenergic receptors, 2 types. If a student says 1 or 2, whatever the answer is, which of these receptors, when stimulated, increases cardiac contractility? Which could be possible use of this action? This is a clinical orientation. Do you know any drug which is selective beta-1 stimulant? How is dobutamine different from dopamine? 1 or 2 liner. Name a clinical condition where you will prefer dopamine over dobutamine, or dobutamine over dopamine. Can both be used simultaneously? In which condition? Next, please. So these are the questions. If a student is able to answer, I think I will assess that he has acquired some higher levels of the cognitive domain. Next, please. Now here is a problem. Equivalent cards. Enumerate 2 types of the adrenergic receptors, alpha, beta. Which receptor subtypes are found on blood vessels? If answer is alpha 1, then there will be a set of questions. If answer is beta 2, there will be equivalent set of questions. What is the action on blood pressure? What could be possible use of such drug? Name one such drug used in shock to raise blood pressure. Which is preferred in shock, noradrenaline or dopamine? In which condition dopamine is preferred? Now, if answer is beta 2 agonist, that will be separate set, but somewhere it is equivalent. Where else are these subtype receptors located? What could be possible use? Which beta 2 agonist is used to relieve acute attack of asthma? And which is used to prevent recurrent attacks? And what are the main ADRs of salbutamol? And what is the cause of tremor? What is the cause of tremor? Next, please. Now, this is comparison. So there is analysis, synthesis, and maybe evaluation. We all agree there are 4 indications which a student must know. This is a must know: hypertension, ischemic disease, thyrotoxicosis, chronic CHF. Now, which 3 common beta blockers are used? Propranolol, atenolol, metoprolol. If a student replies atenolol, which one will you prefer in hypertension and COPD? Give 2 reasons. Should a patient on beta blocker stop suddenly? He has to explain. If he replies propranolol, which beta blocker is preferred in thyrotoxicosis? Give 2 reasons. Suppose someone has taken beta propranolol, he is diabetic on insulin. What are the consequences? You can explain. And similarly, in metoprolol, why is metoprolol preferred in chronic CHF over 2 others? Give 2 reasons. And what are the 2 other uses of metoprolol? So this way, comparative equivalent cards can be prepared to find out the association analysis. Next, please. I think I will use this one for a more than average student. Glimepiride, metformin, ripaglinide, vildagliptin, and canary. Today, all of them are used. Which is the first line drug for obese type 2? Which of these increase insulin release? Which acts directly on beta cell as beta cytotropic agent? Which drug you will identify? 1 meal, 1 dose, 2 meals, 2 doses, no meal, no dose. The student should know this also. Which drug does not reduce plasma glucose level below normal levels? And which one promotes weight loss? If he answers metformin, I'll ask which other also you know is the weight reducing agent. And if he knows, it is very good. Semaglutide is now used for in obesity even without diabetes. So generally oral agents are contraindicated in patients impaired kidney function. Which one can still be used to reduce the postprandial hyperglycemia? Answer has to be ripaglinide because it's mainly inactivated by non-renal mechanisms. Next, please. So this is how we can prepare. Now, we conducted a study in 2015 using same principles which I have discussed. We prepared 3 sets of IO card, each having 15 questions for 10 minutes per student. The student stratified into 4 groups, and the results were: format reduced redundancy and was acceptable to students and teachers and had internal consistency. Marks awarded were objective, evidence-based as against overall subjective assessment of traditional Viva. Next, please. Structuring lowered the marks obtained. Difficulty was equally distributed, but had reduced inter-rater variability, but it was not entirely eliminated. There are many factors which influence the outcome: the rigid time, number of students, and orientation training of the examiners. Next, please. Now, Ganji also studied structured Viva and found a reliable method in dental students. Next, please. This another study which conducted as a ACME project of Dr. Kakkar. If you look at the red line on left side, you will realize that the central tendency is there with the traditional. It is lost when we are. It is the structured Viva had a wider variation in SDs, and so there is no central tendency. Therefore, wide difficulty ranges were used to assess the good and less good student. Another important outcome was that structured Viva correlated with theory examination marks whereas unstructured was always greater than that. Next, please. This now there are at least few modifications which people have done. Nikharde compared the
So voice is not coming.
We seem to have lost Dr. Khilnanai.
and found it to be
Gurudas, sir?
informative.
I guess he lost his network, sir.
Yes, sir. Next, please. Small group structured Viva can also be used instead of one-to-one. It can be used. The only thing is this Viva is better in formative assessment and it can identify lacunae of teaching learning methods. Next, please. Targeted oral, Rangachari used it as a modified Viva Voce. Student faced a mirror and other observed. Now it is a time consuming and time was a major limitation of this activity. He conducted it in physiology too. Next, please. Technology assisted Viva, I think it is should be used more. Remote recording, retrospective marking, pre-recorded multimedia delivery to test the acceptability impact on the student anxiety and potential delays in the summative assessment is more consistent, valid, and fairer to the students. Next, please. So you can see that by appropriately structuring Viva, we can reduce the issues of reliability and validity, and Viva can assess the higher levels of the cognitive domain and provide immediate feedback to the learners. Next, please. Viva needs to be structured to make it more valuable, reliable instrument and valid instrument. Structuring eliminates some of the limitations, but some will always remain. And the last is more important, that we should not be obsessed with too much of objectivity. Appropriately structured Viva can be used as an assessment tool for low-stake formative assessment to improve learning and providing feedback in an authentic setting, which is required in CBME and for IMG. I think I have completed. Thank you very much.
Thank you very much, Dr. Khilnanai. Very lucid examples you have given in your talk, and you have highlighted what is the importance of structured Viva cards, how one can assess the analysis and synthesis of knowledge of students by asking such questions. I think now we can take some questions from the audience or from the chat box. So are there any questions?
So there are a few questions in the chat box, if you can just go through them.
No, I don't see any question in chat box.
There was one question by Ranjit Das. What should be the weightage of Viva? I think you have made that one comment on that. What should be the weightage of Viva in practical or theory? So I think you mentioned that
in
10 to 14
CBME, they have left it to the university.
Yes.
And universities now, what I saw at least in 4 or 5 universities, it varies from 10 marks out of 100 to 40 marks out of 100.
Yes.
So ideal weightage is not actually recommended by the NMC. Dr. Badyal may say something.
Yes, sir. Actually, there is no Viva head as such. The theory Viva is not there. So theory has to be only theory papers. Suppose you are doing a blueprinting. Viva is one of the methods of practical examination which we all use. So what you can do is, for example, our university has done a blueprinting for the practical part. So components are divided. Below that it is written, you can use various methods. So suppose there's one station on which we have written IM injection or something. Somebody who is observing, if there you have a probing questions, ask there. That is a Viva. But the marks will contribute to the marks assigned for that. If that exercise is for 10 marks, whatever question you ask, you also take that into account, and this marks will be for his filling the sheet, doing the activity, the question you are asked. So there's no separate Viva which you will take on the theory components as such. The Viva will be probing questions on the observation which you are making on the practical being done.
Dr. Chitra Khanwilkar has put a question: should we use same card set for all students? It is like a big brief answer questions.
I think this can be done. The only thing is it can be done once only, and they can be left in the question bank. Second is that you have to plan and organize the session that there is no mixing of students. Once a student who appeared in Viva go out, they will. Today there is an electronic age. This becomes a problem actually. So you have to be very careful. I think equivalent cards would be more important.
Dr. Ritesh has asked, can we take Viva in small groups, like 2 students at a time?
Formative assessment, it should be done, I think. Not for the summative assessment. The importance of Viva in summative assessment has been declining, but at least Viva should be used for formative assessment. It should be there at any stage. And this can be done in groups also. Ultimately, our aim is that students should understand.
Dr. Arpana is asking, if 40 students per day, then how much time for each student?
You yourself have told that it is 8 to 10 minutes.
8 to 12 minutes. Yes.
So I think it's consensus.
Are there any questions?
I feel sir has made a very important point, use of the technology in the Viva. Can you say a few more words related to that? It is very important. You have discussed this in the last of the slides. Use of the technology and multimedia during the Viva. Some of the examiners are already using it. How can we further utilize and enhance the quality of Viva?
We must work on it, because Viva in the form of without MCQ and using technology require more effort. So I think at present we must work out what are the other ways we can use technology instead of making MCQs and randomizing it and doing this and that.
As far as my experience, I can share is that I'm using some of the photograph related to adverse drug reactions. I can show it on my laptop and can ask the student which drug is causing that particular side effect. So a student take a lot of interest in that, and then I can initiate what is your opinion? We can continue to enhance the quality of Viva probably.
This can be done.
Yeah, in his very first slide, I think he mentioned that it's not just the question. You can show dosage form, photographs, mechanism of action, or some graphs can be shown and ask them to identify, or some pictures can be shown, and Viva can be taken on that. Like.
Thank you, sir. Thank you.
Sir, I have one question. Many times, when we are selecting a candidate for an interview, government, selection of teaching post or something, the camera, there is a camera which records how the interview was taken of the candidate. So if there is a system whereby audio, video, AV recording of the Viva is done, then I think all the examiner will be very careful in asking the question and not take it lightly.
We can begin with this for formative Viva even. Because now Viva during final examination will be only on practicals or some important aspect related to practicals. So, and say this is not a high stake examination. Please try to understand.
Yes.
This is a low stake situation where a student must know the bare minimum required for IMJ. If he knows more, it's okay. Therefore, in such situations, we can use subjectivity, unnecessarily too much strict things may not be required. Our aim should be that what we say he has understood, and what he has understood should be able to apply when he becomes IMG.
So if there are no questions, I think we can wind up today's session. And I must again thank Dr. Gurudas Khilnanai and all the organizers of this case series 3 for today's session. And Dr. Kamal will summarize and would give his final comments.
Hand over it to organizing secretary, Dr. Sushil Sharma sir, for the final comments.
Thank you, sir. Thank you very much. And this brings us to the end of two very, very nice sessions on logbooks and on art of Viva Voce. We have had excellent discussion also on that. And we have tried to answer many of the questions that were put up in the chat box. But if there are more questions, we have, like I said last time, we have got a WhatsApp group in which we are having these discussions continuously. So all of you are welcome to put those questions in the chat box, and we will 100% address them. So I thank both the speakers for their presentation today, and I also thank both the moderators who have moderated these sessions in an excellent manner. And finally, I wish to thank all the participants for taking out their time and being with us today. So we will stop it here, and we'll meet again on 25th of August for the final session of CBME Series 3. And we have got two excellent topics which we'll be taking up. One will be on alignment and integration, and the other one will be on feedback in pharmacology. So we'll see you again on 25th of August. And till then, we'll continue our discussions on WhatsApp group. Thank you very much, and all the best. Good afternoon, everyone.
Thank you all. Good day.
Thank you.
Kamal sir?
You can close the session. Thank you very much. Thank you for participation in CBME Series 3. Thank you.
Yes, sir. Thank